All right, today we're going to tackle one of the most common things that happens in a doctor's office, being told your blood pressure is high. We are going to walk through the entire journey, step by step, from that one surprising number to a real diagnosis and, most importantly, a clear plan of action. So let's dive in. So imagine this. You're at a routine checkup and you hear those words. And for millions of people, this is a super familiar moment. But it's not the end of the story. Really, it's just the beginning. It's the start of a really important investigation into your health. So the big question is, what happens next? Let's break it down. Okay, so it all begins right here. You can think of this moment as the inciting incident in your health story, that single measurement right there in the clinic that raises a little red flag. It's the spark that really kicks off the entire diagnostic process. Now, if your reading in the clinic is something like 140/90 or even higher, that does not automatically mean you have hypertension. It just means we need to dig a little deeper. Think of it more like a signal flare than a final verdict. The guidelines are super clear on this. A one-off reading can be totally misleading. So this is just our cue to start looking closer. So, how do we get from that one single snapshot in time to the real full picture? Well, that's where the investigation phase comes in. Your doctor's main job now is to figure out what your blood pressure is really doing out there in the real world, away from the stress and hustle of a clinic. You see, the clinic environment itself can make your blood pressure go up. It's a really well-known thing called white coat hypertension. So to get a truly accurate picture, we almost always recommend getting readings outside of the office. This usually means one of two things. Either you wear a special monitor for 24 hours, which we call ambulatory monitoring, or you take readings yourself at home over a few days. That gives us an average, and that average, well, that's the number that really tells the story. And here they are, the numbers that make it official. While that clinic reading of 140/90 was the alarm bell, the official diagnosis for stage 1 hypertension actually comes from an average home or ambulatory reading of 135/85 or more. And if that average creeps up to 150/95, we're talking about stage 2. And you'll notice something interesting here, right? The numbers for the official diagnosis are actually a bit lower for home monitoring, and that's on purpose. It's to account for that whole white coat effect we just talked about. Okay, so let's say we have a confirmed diagnosis. But look, hypertension isn't just about a number. It's about what that constant high pressure might be doing to your body over the long haul. So the next step is to move beyond the what and get to the why it matters by figuring out your overall health risk. And this brings us to a really, really critical concept. Target organ damage. Honestly, this is the whole reason we take high blood pressure so seriously. Because over many years, that extra pressure can quietly, silently cause damage to your heart, your brain, your kidneys, and even the tiny little blood vessels in your eyes. The entire goal of treatment is to prevent this from ever happening. So how do we check for this stuff? Well, we basically do a full health audit. We'll do a simple urine test to check for protein, which can be a sign the kidneys are under a bit of strain. We'll run some blood tests to look at kidney function, cholesterol, and blood sugar levels. We can take a quick look at the back of your eyes to see the health of your blood vessels. And an ECG gives us a good picture of your heart's health. We take all of that information and use it to calculate your estimated risk of having a heart attack or stroke over the next 10 years. All right, once the diagnosis is confirmed and we're clear on the risk profile, it's time to put together the management playbook. And this is a team effort, a real partnership between you and your doctor. And it always starts with the things that you have the most direct control over. So before a single prescription gets written, the conversation has to turn to lifestyle. And listen, these aren't just some nice-to-have suggestions. These are powerful frontline medical treatments that really put you in the driver's seat. Things like cutting back on salt, getting regular exercise, eating a balanced diet, and of course, stopping smoking. These form the absolute bedrock of managing hypertension. And you might be surprised just how big of an impact these changes can have. I mean, it's enormous. Just losing 10 kilograms, or about 22 pounds, can lower your top blood pressure number by a staggering 5 to 20 points. For some people, that one change is as effective as taking a pill every day. These things really add up, and for many, it's enough to get their blood pressure right where it needs to be without any medication at all. Now, if those lifestyle changes don't quite get you to your goal, that's when medication comes into the picture. And we follow a very logical, step-by-step approach. The best way to think about it is like a ladder. We start on the first rung, usually with one type of drug. If that's not quite enough to hit our target, we don't just jump off, we climb to the next rung by adding a second medication. Still not there? We climb to step 3 and add a third. It's a really systematic process that's been proven to be the best way to get blood pressure under control. So what's the actual goal of all this? What number are we aiming for? Well, for most adults under the age of 80, the target is to get that clinic blood pressure below 140/90. That's the same as a home reading of below 135/85. Now, for folks over 80, we actually adjust those targets just a little bit higher. It's all about balancing the benefits of treatment with other health factors that come into play. Okay, so everything we've talked about so far is for the long-term game plan, but we absolutely have to talk about those rare but super critical moments when high blood pressure becomes an immediate emergency. Knowing these red flags is incredibly important. The number that should really set off alarm bells is 180/120. A reading this high needs immediate medical attention, period. But, and this is really important, it's not just the number by itself. It's that number plus specific symptoms that screams crisis. And here's what you need to look out for. If you get that 180/120 reading and it comes with sudden changes in your vision, brand new confusion, chest pain, or a really bad shortness of breath, that requires a same-day specialist review. This is what we call a hypertensive emergency, and it means there's a real concern that vital organs are being damaged right at that moment. So, to wrap this all up, there's a core statement from the clinical guidelines that I think just says it all. It says to offer lifestyle advice and continue to offer it periodically. And that really gets to the heart of managing hypertension. It's not a one-time fix. It's an ongoing partnership, a continuous journey of monitoring, getting support, and making healthy choices day after day. At the end of the day, a blood pressure reading isn't just a couple of numbers on a machine. It's a vital piece of information. It's like a conversation your body is trying to have with you. Understanding this whole story, from that first signal to the long-term plan, is what empowers you to take control and help write a healthier next chapter. So yeah, your blood pressure is just a number. But what story is it telling you?